Let me ask you something. When was the last time the government made something easy to understand? The tax code, thousands of pages. Social Security, a rulebook nobody reads. And Medicare? 4 different parts, each with its own premiums, its own deductibles, its own rules, its own enrollment windows, and absolutely zero requirement for anyone to sit you down and explain how they fit together. There is a reason for that complexity, and it is not an accident. When people are confused, they make decisions based on what they see advertised, and what gets advertised most heavily is the thing that makes the insurance industry the most money, not necessarily the thing that's best for you. Today we're cutting through every single layer of that confusion. Parts A, B, C and D, what they actually are, what they actually cost, and how they actually fit together, in plain English. No jargon, no alphabet soup, just the truth. Stay with us, because by the end of this video, you will understand Medicare better than most Americans who have already been enrolled in it for years. Welcome back to Medicare Exposed. If you're new here, this channel exists for one reason: to give you the Medicare and Social Security information the industry hopes you never find. No commissions, no plans to sell, no agenda. Hit subscribe and let's get into it. Let's start with the big picture. When most people hear the word Medicare, they think of it as one thing, one program, one card, one coverage. It is not. Medicare is actually a collection of separate programs, each covering a different piece of your healthcare. And here's the first thing they don't tell you. You don't automatically get all of them. Some you have to actively sign up for. Some cost nothing. Some cost hundreds of dollars a month. And some, if you skip them, come with that permanent penalty we talked about in video 1. So let's walk through each part, one at a time. And by the end of this, you'll have a complete picture that most people spend years trying to piece together. Part A. Hospital insurance. This is the foundation of Medicare. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. If you need to be admitted to a hospital, Part A is what kicks in. Now here's the good news about Part A. Most people pay nothing for it. Zero. No monthly premium. As long as you or your spouse worked and paid Medicare taxes for at least 10 years, roughly 40 quarters, Part A is yours free of charge. And unlike Part B, which we'll get to in a moment, there is no late enrollment penalty for Part A if you already qualify for premium-free coverage. But here's what people get wrong about Part A. Free does not mean no costs. Part A has a deductible. In 2024, it was $1,632 per benefit period, not per year, per benefit period, which means if you're hospitalized more than once, that deductible can hit you more than once. And after 60 days in the hospital, you start paying daily co-insurance out of pocket. After 90 days, you're drawing from a limited lifetime reserve. Part A is powerful coverage, but it is not a blank check. Part B, medical insurance. This is where things get more complicated and more expensive. Part B covers everything that happens outside the hospital. Doctor visits, outpatient procedures, lab tests, medical equipment, preventive care. Basically, if you're not admitted to a hospital but you need medical care, Part B is what covers it. Now, unlike Part A, Part B has a monthly premium. In 2024, that standard premium was $174, £70 per month. And as we covered in video 1, if you miss your enrollment window, that premium gets permanently increased by 10% for every 12 months you delayed. But here's something else most people don't realize about Part B. It doesn't cover everything. Part B typically covers 80% of approved medical costs after you meet your deductible. You are responsible for the other 20%, with no cap, no out-of-pocket maximum, which means if you have a serious illness or injury, that 20% can add up to tens of thousands of dollars. This is exactly why the Medigap versus Medicare Advantage decision, which we'll cover in a future video, is so critically important. But more on that later. Stop here for a second. Parts A and B together are what's called Original Medicare. This is the government-run foundation, the baseline. Parts C and D are built on top of this foundation, and this is where it gets interesting, because this is where the insurance industry enters the picture. Part C, Medicare Advantage, and right away, I need you to understand something. Part C is not a government program. It is a private insurance product, approved by Medicare, but sold and administered by private insurance companies. Here's how it works. Instead of getting your coverage directly from the government through original Medicare, you sign up with a private insurer who bundles everything together. Part A, Part B, usually Part D, all in one plan. Medicare pays that private insurer a fixed amount per month to cover you, and the insurer manages your care. On the surface, Medicare Advantage looks incredibly attractive. Many plans have 0 monthly premiums. Many include extras like dental, vision, and hearing coverage that original Medicare doesn't offer. And that's exactly what you see advertised on television 24 hours a day. But here's what those commercials don't show you. Medicare Advantage plans come with networks, which means your doctors have to be in that network. They come with prior authorization requirements, which means the insurance company can deny or delay your care. And they come with out-of-pocket maximums that sound protective, but can still reach $8,000 or more per year. We are going to do an entire dedicated video on Medicare Advantage, because the details matter enormously. But for now, understand that Part C is a private alternative to original Medicare, not an addition to it, not a government benefit. A private product with its own rules, its own restrictions, and its own financial interests. Part D, prescription drug coverage. Part D is prescription drug insurance. And like Part C, it is sold by private insurance companies approved by Medicare. If you have original Medicare, Parts A and B, Part D is how you get prescription drug coverage. Because here's something that shocks most people. Original Medicare, Parts A and B, does not cover most prescription drugs. At all. If you walk into a pharmacy and your doctor wrote you a prescription, original Medicare pays nothing. Part D is what covers it. Now, if you choose Medicare Advantage, Part C, drug coverage is usually bundled in automatically. But if you stay with original Medicare, you need to actively choose and enroll in a standalone Part D plan. And yes, there is a late enrollment penalty for Part D too. If you go without creditable drug coverage for 63 or more days after you're eligible, you pay a permanent premium penalty on your Part D coverage, every month, for life. So let's put it all together. Here is your complete Medicare map. Part A covers your hospital stays, usually free if you've worked enough years. Part B covers your medical care outside the hospital, £174.70 per month standard premium in 2024, with an 80-20 cost split. Part C, Medicare Advantage, is a private alternative that bundles A, B, and usually D in one plan. Attractive on the surface, more restrictions underneath. Part D covers prescription drugs. Critical if you're on original Medicare. Comes with its own late penalty if you skip it. And on top of all of this, there are Medigap supplement plans, private insurance that fills the gaps in original Medicare, the 20% that Part B doesn't cover. This is the decision that determines what your retirement healthcare actually costs you. And it is the most important financial decision most people turning 65 will make. We are dedicating an entire video to it, and it is coming next week. But before we get there, let's talk about what you should actually do right now. If you're approaching 65, go to Medicare.gov. Right now, today, create an account. Look at your Medicare eligibility date. Look at your initial enrollment period window. And write those dates down somewhere you won't lose them. Because now that you understand what the 4 parts are, the next step is making sure you're enrolled in the right ones at the right time. And that starts with knowing your dates. Medicare is complicated on purpose. We've said it before, and we'll keep saying it. The confusion benefits the industry, not you. But you just did something most people never do. You sat down and actually learned how this system works. And that knowledge is worth money. Real money. In premiums, you won't overpay. In penalties, you'll never trigger. In coverage gaps that won't blindside you in retirement. That's what this channel is here for. Every week, another layer of the Medicare machine, pulled back and explained in plain English. If this video helped you, hit subscribe and turn on notifications. Because next week, we're covering the single most important financial decision you'll make when you turn 65, Medicare Advantage versus Medigap. Two completely different paths. One decision, no do-overs. You need to see this video before you choose. We'll see you there.